Last week, the Make America Healthy Again, or MAHA Commission, put out a report about the state of child health in this country. So I'm here with Ryan Nebeker, the policy and research analyst for FoodPrint, to talk about what that report was and what's in it. So Ryan, what exactly is MAHA and what is this report?
This was Robert F. Kennedy Jr.'s big selling point during his presidential campaign. And then when he wrapped up his presidential campaign, that became part of the Trump platform. And that drew a lot of new people in. They're really concerned about the epidemic of chronic disease in America. So we look at rising rates of obesity, diabetes, and other problems, particularly with America's children, have become a big focus here. When President Trump came into office, he ordered the MAHA Commission, which was mostly a collection of cabinet secretaries, including Robert F. Kennedy Jr., and then also the Secretary of Agriculture, the EPA administrator, to look at these problems a little more seriously and develop a report.
For folks like us at FoodPrint who've been really interested in trying to make these connections and illuminate these connections for people between how our food is grown and produced and then the ramifications on things like public health, a report like this is quite welcome. What does this report get right?
I mean, a lot of people are really excited to see just nutrition and particularly ultra-processed foods being talked about as one of the big drivers of the bad health outcomes we're seeing in the country. The report covers a lot of things, but one of the major angles is this nutritional crisis. Processed foods are everywhere. They're high in calories. They usually have a lot of added fats, sugars, sodium. MAHA has also really focused in on food additives, so some of the kind of chemical additions to the food that help it last longer as maybe being things that are driving some of these bad health outcomes. We have a lot of research to say that the rising chunk of our diets that's made up of ultra-processed foods is really not good for us. And there's, not a lot of huge general consensuses in nutrition, but one of them is that diets should be mostly whole foods if possible.
So why haven't we been able as a country to eat in this way up until now? What's holding us back? And what does the report say is holding us back? And are those the same thing?
Yeah, I mean, that's where things get a little more complicated because at the end of the day, the food system we have right now is big and complex, and it's not always set up for eaters, right? A lot of the agricultural subsidies that we have in this country are mostly designed to support farmers and make sure that they can maintain an income. And that means that we're producing a lot of what we call commodity crops like corn and soy, and these either get fed to animals or they become the processed foods that we've highlighted in the report. There's also just not that same level of support for fruits and vegetables and other healthy foods. And then, the other big problem is just chronic poverty. And as income inequality continues to get worse, fewer and fewer people have access to healthy foods. And this is where the MAHA report maybe doesn't quite get things perfectly right. One of the things that, they do mention, our current agricultural system doesn't really incentivize us to produce healthy food. But it's worth noting that when you have the Secretary of Agriculture on the MAHA Commission, a lot of that language got really watered down, right? And that's maybe something that politically they're just not willing to touch. But the MAHA report does dial in on the SNAP program. People are allowed to buy pretty much anything they want with SNAP. But the fact that you can buy things like soda, candy, other junk foods has been a big point of contention. And there is some research showing that people on SNAP do buy more of those things. But the report kind of blames that problem on SNAP and the fact that they can buy those things, when in reality, those are simply the most affordable, easy to prepare foods out there. And while the report does recommend limiting those things, that doesn't really solve those other drivers of why good food is inexpensive. And so banning unhealthy food from SNAP isn't necessarily going to get people into a, health food store buying, more organic whole food products.
So speaking of farmers, the advance word on the street about this report was that farmers were really nervous because the report was going to be drawing connections between the chemical pesticides and fertilizers that we use to grow food and adverse health impacts. And in fact, the report does cover how environmental toxins can impact health, but for maybe the reasons you just discussed, it really didn't talk about pesticides that much, right?
When you go from trying to turn your movement and ideals into policy, it just gets really messy pretty quickly. As we said earlier, like Brooke Rollins, the Secretary of Agriculture, is on the MAHA committee. And, for all of the language that I think MAHA supporters really hoped would be there about pesticides, fertilizers, and other agricultural chemicals, it's worth noting that the report largely used the, agrochemical industry's language in calling these things crop protection tools.
The report ends with some suggestions for what needs to happen. Given that the House just passed a huge spending bill last week, how are we to square the findings of this report and its suggestions with what just happened?
You have a spending bill that's making $300 million worth of cuts to SNAP, $700 million worth of cuts to Medicaid. And both of those things, we know from economic analysis, are really going to take money out of low-income Americans, particularly the lowest 20%. When we talk about poverty, nutrition, and health, these things are all loops. If you're not getting a good diet, you need to make up for that with good healthcare access. And if you're not getting good healthcare access, you need to make up for that with a good diet. And taking money out of those people's pockets and removing their ability to buy food at all or access healthcare is just a really bad thing. The other thing that's worth noting, the 10 final recommendations that they made, every single one of them was related to either building out databases or research infrastructure so that we can connect the dots between health things, or about funding new research initiatives into things like environmental contaminants, nutritional factors that influence health. And it's a little bit hard to square with what's been going on, not just in the budget, but already at the National Institutes of Health, at the National Science Foundation, and then also across agencies like the EPA. We've seen hundreds of grants that were directly looking into these issues terminated. Just a couple weeks ago, for instance, we saw the EPA terminate grants that were looking at the impacts of PFAS, or forever chemicals, on the food system. Precisely the kind of research you need to be doing if you're serious about tackling the impact of environmental contaminants on chronic disease. And if you're cutting that research at the same time that you have a report saying you need to fund it, it's just a little unclear how that's going to get squared away. It's going to be really interesting just because, on the one hand, the administration has signaled to the agriculture industry and a number of other industries that it wants to make life a lot easier for them. On the other hand, you have all of this energy that MAHA and RFK brought into the administration. It's a coalition of people that they're going to have to keep happy. So it might be a little difficult to both talk the talk and walk the walk here. At the same time, the MAHA movement has a lot of influencers on their side, and they have sometimes been a little bit loose with the truth or misrepresented how things are happening. A couple months ago, for instance, RFK said that he had reached an agreement with the industry to ban artificial food dyes. When industry representatives spoke to the media about this, they kind of went, huh? Like, we didn't do that. I think it's easy to say that you're doing something, and if you say that you're doing something loud enough to the right people, it will really seem like you're doing something. But in reality, getting those policy changes cemented and implemented is going to be a lot more difficult. But whether or not that matters in this era of just widespread misinformation and influencer-delivered news, it's kind of hard to tell.
And the proof ultimately is in the pudding, right?
This is a point where it's worth noting that the MAHA report didn't just look at nutrition. It also talked about vaccine schedule, what they claim is overdiagnosis of medical conditions and psychiatric conditions, especially in children. And then, this environmental contaminants piece. Like, there's a lot of pieces here. It's going to be extremely complicated. And while any amount of progress on these issues is good, it's just kind of a tangled web of lifestyle factors. And ideally, in a perfect world, if we were able to fund research initiatives that earnestly looked at these things, a good outcome here would be that we'd be able to make specific recommendations about the most important things to change. But it's unclear if we can even expect that at this point, given just kind of the funding ecosystem we're looking at for research and everything else.
All right. Well, thanks so much for your thoughts on that. We'll all be looking forward to the second piece of the report that comes out later in the summer, and I'm sure we'll have more to say about it then.